Hello, everybody, and welcome to the Tuesday edition of Video Clips. And today is the start day, official start day of our Prevent Cancer campaign. And I think that the information I'm going to provide you today will give you some further incentive to begin thinking about preventing cancer instead of focusing on early detection. All right, but before I get into all that, a couple things to remind you about. First of all, the diet and lifestyle course, that 15-module course that I talk about all the time, is fabulous. Both consumers and providers take it. It starts tomorrow. And so it really is time to register. And I know some of you wait till the last minute, and that's really fun for us, but we'll get you in. All right. It's a fabulous course, 15 modules: men's health, women's health, children's health, cancer, autoimmune disease, gastrointestinal diseases, mental health, musculoskeletal health. There's no homework week to week. There is a final project that you may do if you want credit, but you don't have to do it if you are just auditing the course for personal information. So it's inexpensive. I promise you will be glad that you took it. So you can send me an email, pampopper@msn.com, if you want to get squeezed in at the last minute for this class. The next free tour of our websites, followed by a Q&A with me, is September 13th. And this is where I show non-members of Wellness Forum all the resources we have and all the things that you could learn from us, and then engage in just a general health Q&A. It's all free. That is next week on Wednesday, September 13th. Business training is coming up for health professionals. Learn how to make effective presentations, to write newsletters, develop marketing plans, and directories of services, and all the other stuff that is involved in running a business that's healthcare related, starting and running a business that's healthcare related. So then we have lots of specials, all kinds of things going on. So I can just send you a handout if you want. My email address is pampopper@msn.com. All right, so let's talk about cancer. And as I mentioned, the focus of our campaign is to prevent cancer. And one of the reasons is that prevention is best because treatment sometimes doesn't work, and early detection doesn't really save lives as much as advertised. So let me just kind of take you through, and this is new studies I'm reporting to you here. Let's start from the beginning, why we should be paying attention to this. Cancer is the second leading cause of death in the United States, and it's going to overtake heart disease as the leading killer of Americans. I think all of us in this group probably have lost family members or friends to cancer, and some of those deaths followed gruesome treatments that seemed at times to make the patients sicker instead of better. And I can tell you from my own personal experience that I've had situations where I really couldn't tell, did the person die of the treatment or did this individual die of the cancer itself? Now, we have been told that the easiest way to prevent cancer, I mean, people do talk, they give lip service to diet and lifestyle habits, but they really talk about early detection saves lives. And it's been repeated for so long by so many public health officials and nonprofit organizations and medical groups and institutions that people just assume that it's true, but it's not. And belief in screening has diverted a lot of attention from what would really make a difference, which is habits shown to prevent cancer. And that's what our campaign is all about. So I want to talk about this new systematic review and meta-analysis. It included over 2 million patients. And it just adds to the body of evidence showing that faith in screening programs has been misdirected. The researchers concluded that with the exception of colorectal cancer screening with sigmoidoscopy, notice not colonoscopy, quote, current evidence does not substantiate the claim that common cancer screening tests save lives by extending lifetime. And even the screening test sigmoidoscopy that does, it's only an average of 110 days. And by the way, that's why people have screening tests. They think they're going to prevent cancer, and if they catch it early, will extend their life so they can live their full lifespan. It just plain doesn't work. There was no significant difference from mammography, 0 days, PSA testing, 37 days, colonoscopy, 37 days, fecal occult blood testing every other year, 0 days, and CT lung cancer screening, 107 days. The reported reduction in all-cause mortality for screened versus non-screened individuals was negligible, 1% or less for each of these screening tools. The authors reported that this doesn't mean that nobody achieves extended lifespan with screening, but the consideration should be given to the fact that while some people benefit, there are risks associated. A couple of examples would be colon perforation during colonoscopy, or a myocardial infarction following prostate cancer screening. So the key is it's not that nobody benefits, it's that it's a tiny percentage and there are more people harmed in most cases. Screening tests can also lead to overdiagnosis, which leads to unnecessary and potentially harmful treatment for cancers that are unlikely to cause premature death. And those would include things like ductal carcinoma in situ for women and contained prostate cancer for men, which almost all men at a certain age have. Additionally, the more tests performed, the more likely there will be false positive results, which then causes enormous anxiety and even more expense. So the screening programs keep expanding. And at the end, I'll tell you about a new one that's coming that I think should be very concerning to all of us. In an accompanying opinion piece, 3 authors state that even with these data, it's difficult, if not impossible, to reduce or end screening programs, quote, even when research has failed to document significant benefits. The reason is that following the evidence threatens powerful stakeholders. And that's true. There's a lot of money. I think the revenue from just mammography is over $8 billion a year in only the United States. That's not worldwide. They wrote, quote, cancer screening guidelines are often developed by screening professionals, screening organizations, and patient representatives with their vested interests. We propose that screening guidelines should not allow individuals or organizations with clinical, financial, or intellectual interest in leading roles of guidance development. This would improve quality and trustworthiness of recommendations. And so they're basically saying that the system is rigged to favor screening because people make a lot of money on it. And those people who make money on it and those institutions have a great say in which screening programs become common. They also wrote, quote, healthcare representatives and experts must be honest, transparent, and dispassionate about the benefits and harms of screening, expressed in a way that allows real shared decision-making. And the problem is that that's not done. And I've said for many years, before I leave this planet, there are a lot of things I want to get done. And one of them is it just is astounding to me that to buy a house and borrow money to take out a mortgage, you have to sit for 2.5 hours while all these documents are read to you and you initial that you understand and the whole 9 yards. That's required by law. And if a mortgage broker doesn't do it systematically, they can get jail time for not going through with these disclosures that are required. There's no disclosure required by law for harmful screening tests or screening tests that don't have benefit. Now, this is what I was talking about in the beginning, that they're getting ready to make things even worse. Okay, the big they that I refer to are medical institutions and doctors and companies that profit from this stuff. All right, so the researchers also looked at outcomes for multi-center early detection blood tests, or MCED. And a lot of you have written to me about these blood tests for cancer, so this is good timing that this all came out. This involves testing blood samples for pieces of DNA or proteins from cancer cells. Some of the tests, in fact, most of them are quite nonspecific, and a positive test only means that there's an increased likelihood that there's some cancer someplace in the body. Where it is, nobody knows. And so what you would have to do in response to that to really have anything definitive is to have imaging and that sort of thing. And by the way, I've seen some people write about this type of thing saying, well, it'll make more people get screened like they're supposed to. Well, that's not such a great idea. There are a lot of tests in development. There's one available right now by prescription. It costs $949 per person. And the makers of this test say, well, it's not a replacement for these other screening tests. Well, then why are we doing it? The other ones don't work, and this one's non-specific. So you're going to spend $949. Or your insurance company or Medicare or whoever is going to spend $949 to find out that you need another test that doesn't work. A considerable enthusiasm for this product. That's the problem, which means that another useless and potentially harmful screening test is likely to become widely used. The estimated cost, if this actually became widely adopted for people 50 years of age and older, it'd be $100 billion a year. That's higher than the budget for the CDC, which is overfunded as far as I'm concerned. Many prominent health professionals agree that enthusiasm for cancer screening tests is misdirected. One of them is Gilbert Welch, who wrote a great book called Should I Get Tested for Cancer? Maybe not, and here's why. If you're really conflicted about this, that might be a book you want to read. Well, he's been outspoken about this for decades, in addition to writing his book. And he and David Carr, another medical doctor, state that, quote, a rigorous demonstration of benefit that patients are living longer or living better should be required before blood tests for cancer are widely adopted. They write that one of the problems with screening is that while only a few benefit, all can potentially be harmed. Rita Redberg, who's also quite outspoken about the ridiculousness of some of what goes on in medicine, and her colleagues wrote in an editorial accompanying the review that we should exercise a great deal of caution in order to, quote, avoid rushing a dangerous blood test to market. The group also wrote that, quote, such a study unfortunately never occurs after marketing approval, and adds that while the potential for early cancer detection may have broad appeal, evidence that such tests reduce all-cause mortality and an objective evaluation of harm should be required before any more tests are approved. So the first thing is screening tests do not prevent death from cancer. They benefit a tiny, tiny percentage of the population. You are not likely to benefit. You are much more likely to be harmed. I'll tell you what does prevent cancer and death from cancer: better habits. And that's what our campaign is all about. You sign a pledge committing to learn about how to prevent cancer. You sign up for workshops that we are presenting on this topic, how to prevent cancer. Cancer is one of the most preventable diseases that we currently spend hundreds of billions of dollars on every year, but people don't really know things like every pound of fat you carry is a risk factor for cancer. Alcohol is a carcinogen, et cetera. So we're going to have a really, really good couple of workshops on that. You get a $100 gift card just for signing the pledge. All right. I'm hoping you're going to show up for the workshops, but just for signing the pledge, you get a $100 gift card, which you can use towards your virtual conference ticket or 50 other options of things that you might like to purchase from us. And by the way, this is a lot of information I shared with you. I'm going to put it in the newsletter for next Monday with the references so you can read it yourself. But I wanted to share it with you today because I thought it was just a great kickoff for this campaign that we're starting today. I hope that we reach like 1 million people. Wouldn't that be great? And if you want to, you can sign up to solicit pledges from other people. If you're a member of Wellness Forum, you get $50 for every 25 you turn in. And if you're not a member, you get 25. So membership definitely has lots of privileges at Wellness Forum, right? So if you want information on this or business training or the free tour or the diet lifestyle course that starts tomorrow, any of the stuff, just send me an email at pampopper@msn.com and we will get you the information. Let's make a pledge to prevent cancer ourselves. I don't want to get it. You don't want to get it. And let's also commit to tell other people that they can reduce their risk a lot as well. So that's it for today. As usual, pass this on to anybody who you think would enjoy watching it. And I will be getting back to you tomorrow with more exciting news about health.